It's more than 100 degrees in South Texas, and outside of churches, people are praying for mercy.
There hasn't been an individual in our community that has not shed tears.
Dr. Ivan Melendez says COVID-19 has laid bare the vulnerabilities of the predominantly Latino community of the Rio Grande Valley.
But we had all the parameters for a perfect storm: poverty, diabetes, hypertension, multi-generational families.
Dr. Melendez, who battled COVID-19 himself, is also the region's health authority.
I walked into a unit with 90 cadavers, and I recognized that that grandfather, as my patient, was lying physically on top of his grandson.
The loss of life he's seen haunts him, along with the reality that it isn't over.
But here along the border, some families are crossing south into Mexico in search of cheaper treatment, which is where we find our colleague at Telemundo, Julio Vaqueiro, who saw this firsthand.
That's right, Gadi. With more than a third of the Rio Grande population uninsured, many come here looking for medical treatment and medicines that can be much cheaper.
Up to 1 million U.S. citizens come to Mexico for that reason every year.
Have you been crossing a lot during this pandemic?
Because I bring medicine for my husband.
Earlier this summer, Evelia Sáenz's husband developed high fever and difficulty breathing.
Que es algo muy serio.
He tested positive for COVID-19 and was too sick to leave home. So she traveled 25 miles to pick up medication from their doctor.
So we are in Mexico now.
People with no health insurance, like Evelia, flock to pharmacies and clinics just a few blocks from the border.
What's the cost of coming to the doctor here in Mexico? ¿Cuánto le cuesta venir al doctor aquí?
Por la consulta me sale $25 más la...
$25? The visit to the doctor.
After her husband got sick, Evelia and her daughter also contracted COVID-19.
Y los dolorcitos de cabeza.
They still have lingering symptoms.
But back here in the United States, health officials are trying to bring more help to impoverished areas.
That's right, Julio. They're trying to reach underserved communities like this, offering them access to healthcare clinics as well as free testing for COVID-19. How important is it to have a service like this in a community where a lot of people are uninsured?
It is vital. They're faced with that decision to get medical care or do away with medical care because of other necessities.
Elvira Espino is a single mother of two without insurance.
Well, actually a milagro, you know.
Milagro, a miracle.
Everything, whatever I need, they're always here.
This summer, Elvira's father started showing symptoms of coronavirus when he was in Mexico. He tried to return home to the U.S. for treatment, but it was too late.
And he just crossed over, and that's it. He didn't make it to the hospital. He didn't make it to the ambulance.
So he crossed over the bridge, and then he
passed away.
But as so many grieve, there are signs of hope. Latinos here make up over 70% of the volunteers participating in one clinical trial for a vaccine.
We need people to come together to continue to see the big picture. Recognize that we're all in this together.
Doctors hoping that when a vaccine becomes available, underserved communities are not forgotten. Gadi Schwartz, NBC News, McAllen, Texas.
Hey, NBC News fans, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.